My name is Rosan Meyer. I'm a specialist pediatric allergy dietitian. I have several academic appointments. One is within a very well-known university here in London, where I lead the food hypersensitivity module within an MSc, and then I also am visiting professors for two other universities. In addition to that, I have my own very busy pediatric allergy practice where I see patients ranging from IgE to non-IgE mediated allergy. The diagnosis of cow's milk allergy is really challenging for any healthcare professional, and I count myself within the any healthcare professional. And the primary reason for that is that any symptom listed within cow's milk allergy in fact overlaps with symptoms from a different diagnosis. So whilst with an IgE-mediated allergy, you know, the rash and your anaphylaxis, that most probably is easier to identify because you've got some supporting tests. The challenge is really in regards to non-IgE-mediated allergy, which often have symptoms that affect your gastrointestinal tract. So, for example, diarrhea, regurgitation, abdominal pain or colicky type symptoms. And those are very common, in particular in early childhood. They are also known as functional gastrointestinal disorders. And so for a healthcare professional to decide this is cow's milk allergy versus very commonly reported functional gastrointestinal disorders is really, really hard. So there are significant nutritional implications for either the overdiagnosis, meaning we recognize children as having cow's milk allergy when in fact they don't have, and therefore they are eliminating cow's milk and its derivatives from a diet, versus the other category. These are the children where we don't recognize the diagnosis and they continue to have ongoing symptoms. So if we go with the first category, those are the children that actually are over-recognized as having cow's milk allergy and the diagnosis is not properly established. So if we therefore take out cow's milk and its derivatives, what we're leading to is taking out a nutritional source that adds not only energy and protein, but also all of the other micronutrients that are cofactors for growth. In particular, below the age of 6 months, that is actually significant because they don't have complementary food. It's just milk. And if it's a breastfed child, the implication therefore is negative from a nutritional perspective to the mother, because we are therefore taking it out of the mother's diet without establishing the diagnosis. On the other side, the nutritional implication for the children, where we do not recognize them as having a cow's milk allergy, but they actually have a cow's milk allergy, where we don't put them on an elimination diet, these children continue to have symptoms. Now, the symptoms may range from skin symptoms, gastrointestinal symptoms, and outside of the non-nutritional impact of quality of life, these symptoms lead to ongoing inflammation. So ongoing inflammation, whether that's eczema, that it's driving the eczema, or the gastrointestinal tract, so you've got reflux symptoms, pain symptoms, diarrhea symptoms, blood sometimes in the stool as well. And all of those can lead to poor absorption and metabolism of the nutrients. So a lot of the underdiagnosed or poorly diagnosed children that have ongoing symptoms may not be growing well. They can have ongoing feeding difficulties, because imagine you continue to have pain and discomfort and you're expecting a child to continue to feed the only source of nutrients that's causing pain. And so we have to think on both sides, and that's why it's so important that we get the diagnosis right, because the nutritional impact on both sides is so significant.